Mental health problems is something to take very serious, but so is substance abuse and addiction. Now, just imagine having an addiction or substance abuse problem and mental health problems all at the same time. Dual diagnosis, also referred to as co-occurring disorder, is when you have both a substance abuse problem and a mental health issue such as depression, bipolar disorder, or anxiety. Dealing with substance abuse, alcoholism, or drug addiction is never easy. It's even more difficult when you're also dealing with mental health problems. So the question here is, what comes first? Substance abuse or the mental health problem? Well, alcohol and drugs are often used to self-medicate the symptoms of mental health problems. Self-medicating with drugs or alcohol causes side effects and will often worsen the mental health symptoms they initially help to relieve. Today, I will share of what I have learned by explaining how substance abuse or addiction links to mental health and how it affects the human body. Let's start by looking at the link between substance abuse and mental health. Some may think substance abuse and addiction are the same, but they are different. According to an article I read, substance abuse is the earlier, milder form of harmful drug or alcohol use, which may or may not escalate into addiction. Addiction is a chronic, relapsing disease characterized by a physical or psychological dependence on or need for drugs. In dual diagnosis, both the mental health issue and the alcohol or drug addiction have their own symptoms that may get in the way of your own ability to function properly. It could affect your life in many ways, such as being able to maintain a steady home life, function properly at work or school, and handle life's difficulties. What makes the situation more complicated is that the co-occurring disorders also affect each other. When a mental health problem goes untreated, the substance abuse problem usually gets worse. But when alcohol or drug abuse increases, mental health problems usually increase too. Co-occurring substance abuse problems and mental health issues are more common than many people realize. Roughly 50% of individuals with severe mental disorders are affected by substance abuse. Now that you know the link between the two, let's talk about what comes first, substance abuse or the mental health problem. Substance abuse and mental health disorders such as depression and anxiety are closely linked, although one does not necessarily directly cause the other. Abusing substances such as marijuana or methamphetamine can cause prolonged psychotic reactions, while alcohol can make depression and anxiety symptoms worse. People often use drugs and alcohol to cope with difficult emotions. Substance abuse may even trigger new symptoms to mental illness. Drugs and alcohol can also interact with medications such as antidepressant, anxiety medications, and mood stabilizers, making them less effective at managing symptoms and delaying your recovery. Now let's discuss how substance abuse and addiction affect the brain. Addiction impacts the brain on many levels. For example, alcohol depressant will cause disruptions in the balance of the brain, affecting thoughts, feelings, and actions. When stimulants, opioids, sedatives, or alcohol are used, the chemical compound enters the bloodstream or brain. The moment the chemical enters the brain, it can cause people to lose control of their impulses or crave a harmful substance. Drugs change the nerve cells that normally send, receive, and process information called neurotransmitters. Finally, let's look at the treatment for a dual diagnosis. The best treatment for co-occurring disorders is an integrate approach where both the substance abuse problem and the mental disorder are treated simultaneously. Long-term recovery depends on getting treatment for both disorders by the same treatment provider or team. Treatment for the mental health problem may include medication, individual or group counseling, self-help measures, lifestyle changes, and peer support. Treatment for your substance abuse may include detoxification, managing of withdrawal symptoms, behavior therapy, and support groups to maintain your sobriety. So I've given you a lot of information. Let's review. Today we have learned about the link between substance abuse and mental health. We learned that some substance abuse often happens to ease symptoms of an undiagnosed mental disorder or to cope with difficult emotions. We learned the difference between substance abuse and addiction. We also learned about the treatment of co-occurring disorder. It is very important to take care of yourself, whether you think your mental health isn't a big issue. If you are feeling any type of way that you think that isn't right, look for professional help, and so you just don't have to turn to substances for help. So if you think you have a possibility to have a mental health disorder or whatever, just make sure you are looking for help and going to professionals for the help.